Welcome back. LA has seen a rising rate of violence over the past few years, especially gun violence. And no one has seen the effects more than the staff at Los Angeles County USC Medical Center Level 1 Trauma Unit. They played an integral role in caring for victims of some of our deadliest local shootings, like the devastating Monterey Park shooting in January that killed 11 people and injured 9 others. LA Times senior producer Karen Foshay got an inside look.
We've had a significant increase in the amount of gunshots and stabs, but mostly gunshot wounds.
In the emergency department, the number of gunshot injuries seen increased by 68%, and the number of deaths in the last 5 years increased by 93%.
I think violence, especially firearm violence or stab or wound violence, is a public health crisis, and we don't treat it that way. And I think violence should be treated just like we do high blood pressure, like we do diabetes, like we do cancer.
It's an epidemic.
And Karen is here with us this morning to discuss all of this in this morning's brief. Thanks for being with us. Really good reporting. Gun violence, of course, top of mind right now with the Nashville shooting most recently, the Monterey Park shooting for us. What did they share about treating victims that go through events like this?
Well, thank you for having me. What I found was really interesting was that the Monterey Park shooting, where they had 4 to 5 victims, was just another Saturday night. For the doctors and nurses I spoke with, they said this is what they deal with every single day. In fact, the day I was there, we got rare access to the trauma unit. The night before, they had 8 victims. 8 gunshot wound victims. So this is very typical. In fact, this is one of the busiest trauma centers in the country. And honestly, one of their specialties is treating gunshot wound victims. And what I thought was really interesting is that, again, this was just another Saturday night. They didn't even have to elevate the level of care that night. The doctor said we were prepared. This is what we do every day. And as you saw in the piece, what they're really concerned with, though, is this trend, this dramatic increase in both deaths and injuries at that hospital. It didn't even slow down during the pandemic. It just keeps going up and up and up.
Yeah, this is not something that happens this is akin really to warfare victims and gunshot wounds. You mentioned up to 10 victims in a given shift, and they are one of the busiest trauma units across the country. We've been through that. What did you learn about trauma care in general here in America and here in Southern California and LA particularly after speaking with them?
Yeah, well, it was interesting. In fact, the day we were there was a physician from the Navy. The Navy actually sends medical personnel to LA County General for training on how to deal with combat injuries, specifically gunshot wounds. And the reason why is because they just have such a deep experience. And one of the doctors you saw in the video there, Dr. Dimitriades, is considered one of the world's leading experts in treating gunshot wounds. When you get shot, these are complex surgeries. They have challenges that they just don't see with, say, stabbings or blunt force trauma. So what's interesting about LA County General is it's also, academic hospital, right? It's a teaching hospital. So that's another reason why so many people, including doctors within LA, go to this hospital to train on how to deal with these gunshot wounds. And I'll tell you something, there's of course the personal toll. Some of these victims end up staying months. There's costs, we're talking about rehab, some become more permanently injured, and the cost of that is real. So if you think, well, how is this affecting me? Well, we all collectively pay for this. Paying for this care is incredibly expensive. And of course, this is a public hospital, so ultimately we all pay for it.
Yeah, a really good reporting, very insightful about what they're actually doing every day and night here in Los Angeles. Karen, thank you very much for joining us. And you can see the whole piece by scanning the QR code on your screen. This full segment will be on our website, kcalnews.com/SeenOnTV.